Hi guys, I've said before that Boris Johnson's sister Rachel isn't the sharpest tool in the box, and she hosted a call on her show that demonstrated that she was in good company. As we know, the NHS is facing a crisis, and the waiting list in England currently stands at 7.2 million patients. We've been hearing all sorts of ways to quote-unquote fix the problem, but as it stems from a staffing crisis, few of these solutions will actually resolve that problem. A worrying trend is to copy ideas from the USA, which has a completely dysfunctional healthcare system. Have a listen to this.
Really honest, I think that companies, if they employ over 100 people, should all be providing private healthcare. I really do. I think that would be an enormous bonus for everybody. And I think that there should be something that's actually widely considered by everybody. And even if there's a reduction in NI payments for companies that do that, I think it's a really important thing.
Okay,
I think
just to alleviate pressure on the NHS?
Exactly.
Right.
Alleviates pressure, doesn't take enormous money out of the system, but those waiting lists would go down, and those people who really don't have the opportunity to use those services will have a much better chance, at being treated early for cancer, being treated early for whatever condition they're suffering with. And I think that actually companies should offer it. Everyone has to offer a pension, and I think healthcare is very, very important.
And you think that they should stump up for the entire bill for healthcare for each of one of their employees? That's going to be a big bill because it's expensive. As you get older, your healthcare per month or per year goes up. It just ratchets up automatically. Do you really think companies can afford that?
I think that companies, when they're looking at staff absence because of ongoing health conditions, have enormous bills already, and I think it could be heavily reduced.
That's not a bad shout. I mean, I wonder what companies think. I mean, I know a lot of companies do offer, medical and dental. I don't know if they offer mental health as well. Maybe that's something that would stop people quitting and stop people leaving the workforce over the age of 50, Nicola. It's really, really not a bad idea.
Okay, it is a bad idea because, first of all, it's not going to deal with the waiting list. How is it going to deal with the waiting list when the waiting list is a staffing problem? Encouraging more people to go privately is not actually going to reduce the waiting list. It just moves people from one waiting list to another waiting list. And second, what it does is it creates a two-tier society where people who are working, normally in very well-paid jobs, will get free health insurance, while people who aren't working will get nothing, and people who are doing, 0-hour contracts or on very bad contracts, they're going to get nothing as well, because it'd be too expensive to provide health insurance to people. So you're going to have, once again, big companies, multinationals, will be able to provide free healthcare to their staff, and everyone else will have to rely on the public service. That's once again a two-tier society. You don't want that. And also there's another problem that stems from the United States where people do jobs in places they don't want to be. So they're doing jobs they don't like in a location they don't want to be for the healthcare. Because if they shift jobs, they move to another location, they're going to lose their healthcare. And they continue to do jobs they don't like, the stresses and the problems that go along with that, in order just to be able to hold on to the healthcare because it's so important. You shouldn't be doing a job for the healthcare. You should be doing the job because you want to do the job. This is a problem with this American style approach. And I'm really concerned that there are more and more people coming out on the radio and in newspapers talking about maybe we should copy what the US is doing, or maybe they're not even as explicit as that, but they're saying, what about this or what about that? These are not solutions. The waiting list is a consequence of a conservative government that's been in power since 2010 and has destroyed the NHS. And not by accident, it's by design. They want more and more people to rely on private healthcare, either just going there directly or relying on health insurance, which is extremely profitable in the United States. And we've seen Rishi Sunak and others go to the United States recently and come back with some of these ideas, it seems. this is not necessary. It doesn't have to be like this. And these solutions where you ask companies to provide healthcare or you ask people to go privately is, in some cases, it may be able to reduce the waiting list in the short term, but this cannot be a long-term solution. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.